Recently, the Brazilian Society of Cardiology put out a report which lists what they say are 10 reasons to continue a prohibition on ends. By ends, they're mainly referring to vapes and heated tobacco products, and they're referring to a ban that was imposed in 2009. Since then, we know that the population of consumers of tobacco products in Brazil have responded by using the very products that are allegedly banned on the Brazilian market. Maybe 10 to 15 million have tried the products, and about 2 to 3 million use them on a regular basis, proving that consumers demand and want better ways to actually continue to use nicotine safely. So, what does the society say among the 10 reasons? Amidst them, there are a whole bunch of really curious things. One is that we should continue the prohibition because otherwise it'll undermine Brazil's status as a global leader in tobacco control. Wrong. It actually undermines the very credibility to use non-science-based approaches. Second, it says that it will go on to encourage kids to actually go and start smoking at higher rates. Also, wrong. There have been tons of studies led by cohort analyses, particularly in the US and the UK, that constantly show that is simply not true. What does happen is almost the opposite. Kids who actually use e-cigarettes are substantially less likely to go into smoking or hard drugs. And it is the means of actually getting them off smoking that is actually being so beneficial, as we've seen in the data from UK, from the US, and even from New Zealand. I won't go through many of the others, but they're also in that sort of semi-emotional political tone. The ones that I think the cardiologists should certainly be called to account for is when they talk about the damaging effect of vapes on cardiovascular disease and the damaging effect of vapes on undermining cessation. On the first, there have been many studies in the literature suggesting that vapes increase your risk of cardiovascular disease. Without exception, every one of those studies has been shown to be methodologically biased. Some have been formally retracted from journals. Articles, for example, by Stan Glantz and more recently other people have been formally withdrawn from the journals on the basis of their being methodologically flawed. These should no longer be carried, particularly by a learned cardiology society in Brazil, in one of the leading cardiology journals in the country. And then we get to cessation. The evidence has just been piling up for the last 7, 8, 9 years. It started with the Cochrane Collaborating Group in the UK, who pulled together the world evidence, asking the question, how effective are vapes compared to nicotine replacement therapy and other forms of therapy? The answer over the last few years has grown stronger and stronger, and now they conclude vapes are the most effective means to quit smoking completely. They are twice as effective of nicotine replacement therapy. And Nancy Rigotti, writing in an editorial in the New England Journal of Medicine, made the point that physicians need to act on this advice. And by this, she means when faced with a patient who smokes, somebody who may be in the early stage of cardiovascular disease, or in fact not yet have symptoms, somebody with early respiratory disease, somebody who also is concerned about their cancer risk, maybe somebody who has serious mental health conditions and smokes, where the smoking rates are much higher. They should be given what is the equivalent of sound medical advice that we would give about taking your blood pressure medication on time, taking your diabetes medication on time. Now they should be told vapes constitute your best success possibility of ending your smoking habit. And if you don't end completely and you continue to use them, you are substantially lowering your risk, as we know from the very documents that the FDA in the US has put out saying that when they approve vapes or heated tobacco products, they say these are now appropriate for the protection of public health. If they're appropriate for the protection of the public health of Americans, they must be appropriate for the protection of the public health of Brazilians. Brazilian Cardiology Society really should be ashamed of themselves, putting out a statement that is misleading, distorting, and causing their physician colleagues to give incorrect advice that will lead to the untimely death of many, many patients around the world. I hope this formally gets retracted as soon as possible, And that again, they look to the past success they've had in harm reduction in areas of drug abuse and HIV/AIDS, and rather embrace that. It's the way forward to improve the heart health of Brazilians.